Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and good afternoon, everyone. I'm happy to report that there are no new cases of COVID-19 again today, and there are only 3 active cases. Dr. Strang will have more details in a minute. But first, I want to congratulate the teachers, staff, administration, parents, and most of all, our students for having the courage to go back to school yesterday. I'm so proud of all of you because I know this wasn't easy. I hope yesterday helped you to see that there are supports there for you and your children, and that principals and teachers have your children's safety top of mind. I know this is only day 2, but we will continue down this path, and if there are any signs of a spike in cases, we will pivot. We have ramped up our testing since university students have started to arrive from outside of the Atlantic bubble. Since August 20th, 3,200 students have arrived into our province after completing a safe check-in form. More than 6,000 COVID tests have been completed, and Dr. Strang will have more details on those tests. But so far, so good. Regardless of how they tested, students coming in from outside of the bubble must isolate for 14 days. That applies to anyone coming from outside of the bubble, for that matter. Students will undergo a series of tests, will continue in their isolation, and I want to thank them for their cooperation. Isolation, I know isolating is not easy. You would rather be out socializing, but it is necessary, and I want to thank all of our post-secondary institutions. Your cooperation has been outstanding. We are all in this together, and we would not be able to keep our case numbers as low as they are without your support. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And I'll start by giving an update on our cases here in Nova Scotia. So, as the Premier said, as of today, we have 3 active cases of COVID-19, and our total numbers are, we've had 1,086 cases of COVID-19 so far in Nova Scotia. We've had 81,092 people tested with negative results, and we've had 65 deaths, unfortunately. Yesterday, the Nova Scotia Health Authority's lab completed 801 tests. And since we were our briefing last Friday, we have announced 1 new positive case of COVID-19 that was announced on Monday, and I'm going to explain that case in a bit more detail. Anytime we announce a case, we need to balance providing details for the public with the individual's privacy. But I feel it's important to provide some more details around this case because the individual is a home care nurse in the central region, and there's been a number of communications about this in the public already. This person had COVID several months ago and recovered. That's why this test required much more investigation from public health in collaboration with our laboratory colleagues. The individual's test results have been inconclusive, and we are working with our local lab and the national lab to determine whether this is a true case of reinfection or not. In the meantime, out of an abundance of caution, we are assuming that this is a new positive case and taking the appropriate public health measures. We do not want to wait. We can't wait to get the final question or answer from the lab, whether we ever get that or not. We have to make decisions and take timely action, and we're always erring on the side of caution. We know that this individual wore full personal protective equipment and followed the appropriate infection controls while working. And public health has been following up household and close social contacts, and we have been working with the home care agency, assessing each home care client and what was done in the home for that individual to determine their risk of exposure, and appropriate actions will be taken for each client based on these individual assessments. I want to remind people that we updated the list of COVID symptoms on Friday. People should contact 811 for assessment, and preferably, if you're able to, do it online. If you're not able to do it online, call 811. But they should contact for assessment if they develop a new fever, And often that people don't have a thermometer, but if they have chills or sweats, so if you develop a fever, that's the first symptom, or a new or worsening cough, or 2 or more of the following symptoms if the symptoms are new or worsening of chronic symptoms: sore throat, runny nose or nasal congestion, headache, or shortness of breath. We have refined that symptom list from our broader symptom list. Simply as we got more experience with the broader symptom list, we understood how people were presenting with COVID, and we're very comfortable with this much more refined list, which is close to where we started at the very beginning of COVID. So all that is that symptom list is part of our information that's on our online coronavirus website. But it's important that anybody who's having those symptoms do the online contact 811 and get further direction from 811. I'd like to move on to an update on post-secondary education, as the Premier touched on. Over the past number of weeks, we've been welcoming University and Nova Scotia Community College students into the province to start or continue their studies. And I know that some Nova Scotians have been worried about so many people coming into the province at once, especially from outside the Atlantic bubble. That's why we worked with universities and the community college to put plans in place to welcome students back to campuses safely. And based on information from the universities and the discussions I and my public health colleagues have had with them, I'm pleased to report that it has been going well. As the Premier noted, about 3,200 students have entered the province or have entered Nova Scotia from outside the Atlantic Canada. And for the most part, they are doing or have completed their 14 days of self-isolation and their COVID-19 tests. Compliance with the digital check-in is very good. And the fact that we have only had 3 cases among the first 3,200 students bodes well. That's good news for all of us. So it's good news in 2 ways. It shows that the risk from students is relatively low, but it also shows that our strategy has worked, because we had 3 individuals who, without the measures in place, could well have been following a normal student life and having much more significant potential exposures here in Nova Scotia. I want to thank students for their cooperation with these important public health measures. And I know that it's been a very different university or college experience for you so far, but students have taken on a broad responsibility to each other, to their institution, and to the wider community that is hosting them during their time educational time here in Nova Scotia. For the small minority that isn't doing this or isn't doing what they're supposed to do, I ask them to please think about the potential impact on their friends, their neighbors, their fellow students in the university, and the general community that they are now part of. It's very important that we all do what we can do to keep each other safe. I was made aware of a very long outside lineup at a Halifax bar on the weekend, and very clearly by the pictures there, people were not practicing physical distancing. This is very concerning for all of us, or should be concerning for all of us. Is very concerning to me, because we know facilities like bars are high-risk environments. This has been demonstrated yesterday by the decision in British Columbia, based on their epidemiology, that they have closed down nightclubs and supper clubs because of the important contribution that they were making to the spread of COVID-19 in that province. Safety in what I'm going to call entertainment establishments is everyone's responsibility. Our restaurants and licensed establishments have clear guidelines that they must follow to operate safely, and we have enforcement and inspection on the ground in these facilities. But patrons also have to take responsibility for their own behavior and how it impacts others. As the fall term gets underway at our post-secondary institutions, it's very important that all of us, students who we welcome into our communities, as well as ongoing community members, continue to practice all the personal protective measures. We need to socialize, but socialize safely, in small groups, no more than 10, and keeping that group of 10 as consistent as possible. If people go out to a bar, you need to respect physical distancing in the bar and in the lineup. You need to continue to wear masks as required, and wearing a mask does not mean you can forget about physical distancing. The two go together. They don't replace each other. As I said, I believe it's the minority who need this reminder. Much more often, we're hearing from students and about students who are trying to follow the rules. And I want to clarify a point that's come up a lot, that a lot of students are wondering how they can continue to self-isolate while they have roommates. The bottom line for them is they need to stay apart as much as possible and be vigilant about hand washing and cleaning. We have a lot more information on our coronavirus website, but a few key things is that they are not to have visitors. There are arrangements that they can make to have groceries and other essentials delivered. If possible, using separate bathrooms and keeping to their own bedroom. Not sharing personal items like toothbrushes, their own cups, etc. Trying to keep shared spaces like kitchens and bathrooms frequently cleaned, and as much as possible using windows and other forms of ventilation. And again, frequent cleaning of what I call commonly touched surfaces, door handles, light switches, etc., using a disinfecting cleaning. If they have a roommate who continues to self-isolate, but the student themselves is not, either because they are not required to or they have completed their isolation, then that student is able to leave their home and go about their business as usual, following all the other public health requirements as long as they remain well. And even when even when all the self-isolation is finished, and for a lot of students it is coming to an end, it's important that students continue to remain focused on COVID safety throughout the upcoming school terms here in Nova Scotia. You will be establishing a regular routine, but it's not like previous university years. Our case numbers remain low right now, but we are still in a pandemic. We still need to remain vigilant, and we know that that for a number of factors, in terms of the age groups that we're seeing increased activity of COVID across the country, the social factors that often go with this age group, there are significant risks, and we need to all be careful, and we really need to work together, even while you're here for university, and socializing is part of that. We need to socialize, but socialize safely. It's important that students understand this, and that our communities are doing what we can to support students in this. We all need to keep COVID-19 out of our communities. Then that is how we allow our communities to be safe. It's how we allow our educational institutions, which are and will remain a priority for us, whether they're universities or whether they're our public schools. It's how we allow them to remain open. Education is an important priority. And to do that, we all need to continue all the preventive measures. So I'll go through them yet again. That means wearing a mask where necessary, physical distancing where possible, following good hygiene and cough etiquette, and if people are unwell, they need to stay home and do an 811 assessment. It means not going to big parties or being in close contact with lots of people in social scenarios. There are other ways to socialize, but again, to socialize safely without creating high-risk situations. This is extremely important, not only to protect each other as students, but also to protect everyone in our communities, especially our most vulnerable populations. And speaking of vulnerable populations, I just want to talk a little bit about the long-term care designated caregivers that was announced yesterday. The pandemic has been particularly difficult for our long-term care residents, but they remain one of the highest risk group of severe consequences from COVID-19. So we need to continue to be extremely careful with these facilities and the residents. We have been able to, throughout the summer, gradually loosen visitor restrictions. We introduced first outdoor visiting then expanded that and added indoor visiting. We have allowed residents to now go for off-site medical appointments. They're allowed to open things like hair salons, and we've in the recent past we've actually dealt with some of the liability concerns through the emergency measures to help support facilities to adopt these measures. But as announced yesterday and comes into effect September 11th, we are giving the ability now to have family members, a designated caregiver that could be a family member, to help care for and support their loved one in a long-term care facility. A designated caregiver can be a family member, a spouse, friend, or other support people. They must have an established caregiving relationship that was there prior to the pandemic. They can help with specific caregiving tasks like personal care, mobility, or help with eating. Individual long-term care facilities will work with residents, families, and substitute decision makers to identify up to 2 designated caregivers per resident. Only 1 designated caregiver can visit at a time, however. And these designated caregivers will be trained on the public health requirements, including how to wear a mask properly and safely, good hand and respiratory etiquette, or hand hygiene and respiratory etiquette, and the facilities that may be specific to each individual facility. We have to remember that these individuals are not doing more advanced care, so they don't need training in health care related infection control and personal protective equipment, but they'll have specific training on the very basics that they need to, hygiene measures that they need to follow to safely provide that care. Facilities will be providing medical masks for these such caregivers, and they will, each time they come into the facility, they'll go through appropriate COVID screening. And as I said, this will come into effect on September 11th. So in conclusion, as we head into the fall, I need to continue to ask everyone to care for each other, to keep our community safe by following all the public health measures that will allow us. We've been labeled the Atlantic provinces as the New Zealand of North America. So if we continue to do all the things that we are supposed to do, we can continue to remain in such a safe place. But it is incumbent upon all of us. Our low numbers don't mean we can ease up. We need to continue to wear masks, physical distance, practice good hand hygiene and cough etiquette, and staying home if we're unwell. These are the things that we need to focus on, and these are the things that will get us through safely the coming weeks and months. Premier.
Thank you, Dr. Strang, and we'll, Kirsty, open up to questions.
We'll take 1 question and 1 follow-up in the amount of time that we have for today. First question goes to John McPhee with the Chronicle Herald.
Thank you. Dr. Strang, regarding the possible reinfection, I'm just wondering if this raises any flags, any level of concern regarding past cases, obviously, and I'm thinking particularly of people who work in the long-term care homes. What level of concern do you have with this possible development?
So there have been a couple of cases well established now in the scientific literature where they've gone through extensive laboratory testing on strain identification of the virus, a number of things to actually show that these were people that have been infected more than once. The small number of cases, just a few, and we need to investigate our case to try to see if we can actually get the right test done to see if we can actually establish, was this a case here in Nova Scotia and Canada. They're important because this has implications for our understanding of immunity. The implications of reinfection mean that we are raising or making it more likely that we can't count on a one-time infection producing lifelong immunity. That's actually not a surprise to us. You know, most respiratory viruses act like this. So what it does, it means that you can't rely, anybody who was infected in the first wave, we can't just assume that they have immunity now. and they have to follow all the public health measures like anybody else. And if they are healthcare workers or other specific settings, they will have to follow all the specific procedures just like anybody else. Previous infection seemingly does not give a guarantee of having immunity beyond our cutoff point is about 3 months.
John, do you have a follow-up?
I do. I have a question about the situation at the Canada Games Centre. There was a person who used the fitness facilities there that was infected. I'm wondering, was that is that being considered a travel-related case? And if that is the case, the Canada Games Centre requires people to undergo a 14-day isolation. So I guess I'm just looking for more details on that case and any follow-up that you may be doing.
So at all our public spaces, we've asked, gyms, other facilities, lots of public places to have the kind of screening questions. If you're not feeling well, don't be here. If you've been outside of Atlantic Canada the last 14 days, they're all self-administered kind of questionnaires where people are meant to adhere to. The reality is that we've had a number of exposures like this. We do a public notification when there's been a COVID case, even if there's a modest risk of exposure. We want to inform others who may have been exposed because by virtue of being in the facility at the same time, that they could have been exposed and the symptoms to watch for. We don't do this. We only do this, as I've said at previous briefings, if we can't. Our first objective is to contact all people who may have been in close contact directly, and we only use a public notification if that's not possible. And usually these are lower risk environments. Just because you've been in the same facility at the same time doesn't mean for sure you've been exposed, but it's important that we inform people when we need to, and then therefore they can be alerted and be, I guess our request is that they monitor their health very carefully for the period of time specified, and that if they get any symptoms that they then undergo assessment through 811.
Next question will go to Mike Gorman with CBC.
Dr. Strang, in the case of the nurse, do you have a sense of how this person has potentially recontracted the virus? And I think you also mentioned that in the course of their business that they were following the proper PPE protocols. In a situation like that, how much risk would there even be for the people that they would be treating during home visits?
So your first question, that's part of what we're looking at. What is the explanation of if this is a reinfection, where did this person get infected? And right now, there's no clear indication of that. It's part of what makes this a complex issue to work through. The question we're grappling with is this really a new case and the science behind that, but also then where did they get infected, or is it somehow we're detecting somebody as I said, this would be beyond the 3-month cutoff. Are we still detecting residual virus in this individual? So there's a lot of scientific questions that we're working with. But as I said, we don't know for sure the source of exposure. It's one of the questions we could still continue to look at. As for your second question, that's why we're doing an assessment, because even though the individual was wearing appropriate PPE following infection control, they provided different types of care for different individuals. So that's why the public health is working each individual case to do an assessment to basically say, has this person had enough exposure, the client, that we would consider them a close contact, and therefore they need to be tested and be isolated, versus somebody who's not a close contact, and then we would just be advising them that they may have been exposed and monitor their health carefully.
Mike, go ahead with your follow-up.
On the theme, I guess, of us being New Zealand, of North America, Dr. Strang has talked about how part of the key to that is the approach that we've been using, and in essence, I suppose, our isolation. How does that desire to stay that way inform the way you're looking at whether or not you will eventually ease the restrictions as they relate to the quarantine requirements for anyone who would come here from outside of Atlantic Canada?
Well, obviously, the epidemiology will be a big part of that. As you know, at the very beginning, we had said all along we need to see really 28 days, 30 days of low infection rate. We have seen that. We have welcomed in, thousands of young people, 3,200 young people into our province that we have been testing. So far, so good. Isolating, it gives us a good sense and I think gives communities some level of comfort that people can come in from outside of our region, from different parts of the country where their infection rate is low as well. And we always have to balance, as we continue to do, is the economic health of our province. At what point do we need to be able to recognize we need to live with this virus, follow some protocols, and when you are coming in, regardless of whether you are self-isolating or not, there's public health protocols we require you to do. But we're not there yet, but it's all part of, it'll be all part of that analysis.
Next question will go to Global's Alicia Draus.
Thank you. This is kind of similar, but as it stands right now, returning workers in New Brunswick are not required to self-isolate, and in PI, they are required to self-isolate until they get a COVID test. Last week, Newfoundland and Labrador also eased restrictions requiring returning workers to only isolate for 7 days if they got a negative COVID test result. So will Nova Scotia consider easing restrictions for those returning from work as a partial measure before fully popping the Atlantic bubble, and why or why not?
So I'm working with people on my team, working with some representatives who represent these rotational workers. We'll be bringing some. So we're looking at various options. We clearly understand that the impacts and the imposition on these people that go back and forth to work camps, and when they come here, they have to remain isolated. But at the same time, we have to understand that the work camps remain potentially higher risk environments. There's been a number of work camp outbreaks in some of in northern Alberta, for example. So we need to find a balance, and we're actively working to perhaps have a modified isolation for them. So we're looking at that, and I'm going to bring some information to the Premier in the very near future.
Alicia, do you have a follow-up?
Yeah, so I know this is still about a month and a half away, but a lot of kids have been asking about Halloween. So have we given that any thought, how that might go this year?
So I think, I mean, that's where family decisions, but I mean, there's no reason that you can't practice Halloween safely, maintaining physical distancing, maybe modifying how you give out candy if you choose to do so. Maybe there's other ways to practice Halloween. I think we're not looking at putting restrictions on Halloween. I've talked with my team about it, and we're already working on some more safety messages about if you choose to practice Halloween, how you do that safely. I have to, as you asked the question, I also have to comment, Halloween has become very much an adult a social event as well. So it's very important that my comments that I made earlier today around socializing safety, bar environments, etc., that we're cautious around Halloween on that. And I've certainly flagged the Halloween period for my inspector colleagues as we go about our normal inspection around restaurants and licensed establishments.
I bet my young nephew Landon is going to dress up as Dr. Strang. I'll almost guarantee that. I think you've got a bit of a following there, sir.
Well, I've been saying that I'm going to dress up as a COVID virus and be the scariest thing around. But
Next question will go to Cassandra Nadola-Marsh with Radio Canada.
Premier, I just want to do a follow-up to your answer on Michael's questions, because I'm not sure that I understood. So you're open to opening up the province without isolation to some parts of Canada before opening up to the whole country, or is it going to be?
We're not there yet, but when we look at it, it'll probably be looking at the entire country.
Do you have a follow-up, Cassandra?
Yeah, so.
The point I was trying to make is that there are other parts of Canada that the low infection rate is equal to Atlantic Canada. So I think it's just a question of, when people feel comfortable, and I'm not in any way dismissing the anxiety people will feel when we do that. So it's part of just trying to socialize that with them, and we've been doing that for a while. But we will, when we do it, it'll probably be to the entire country.
So last time you, Dr. Strang, you eased up the restrictions for gatherings was in June. Is it something that is gonna stay that way right now, like the minimum of 10 people without social distancing, or is it going to rise?
So we continue to look at that. It's it's one of our public health measures is using the gathering limits and under the public health order to try to minimize groups of people getting together. It's not just the number of 10 in social groups. We've also allowed up to 50 with physical distancing, and then we've had under specific organizations 200, 250 indoors and outdoors. So we continue to look at that piece. One of the things we're actively looking at, I've got a meeting coming up in the next week or two, as I've said previously, that we need to get schools open, universities open. There's been a lot of questions around sport and other recreational activities, and the number 10 would we be open to increasing that number. So we looked at that in the end of the summer, and we said we weren't going to change that number because our priority was educational, opening educational opportunities. We're now, as I said, we're now going to be looking at that number specific to sport and other kind of theater, arts kind of activities. There's no decision made on that yet, but I use as an example of how we continue to always look at decisions we made around numbers or other pieces and say, is it appropriate because of the epidemiology to be less restrictive? At the same time, I had a long discussion with my team this morning about if the epidemiology starts to increase, what are the things that we need to, and how would we prioritize areas that we need to become more restrictive on? So it goes both ways.
Next question will go to Chris Halef with News 95.7.
Yeah, this question's for Dr. Robert Strang. Yesterday during the Health Committee meeting there, you mentioned that our province is in a good position or a decent position to deal with a potential second wave. I was just wondering if you could just maybe elaborate on that a little bit and maybe tell me what specifically the province is doing that would benefit us, or put us in an advantageous position to deal with the second wave.
Well, I think the things we did to manage the first wave, and what we've continued and now and will continue to any recurrence, based on having built and maintained substantive capacity for people to be tested, whether starting with 811. We established 26 primary assessment centers. We've added 8 or 9 temporary assessment centers onto those for universities, and then we built substantive capacity in our lab. As I talked about yesterday, before at the very beginning of COVID, we could do 200 tests a day. We now have capacity to do 1,500 or more tests a day, and we've sustained that capacity, and we've got plans in place to go well beyond that if necessary. So that's a core piece of early detection of people is critically important, and the public health capacity then to follow up those cases, isolate cases, identify and quarantine contacts. That's how we limit spread. So that piece. The second piece is, as all Nova Scotians, doing all the preventive measures. By and large, that has worked well. That has served us well. Nova Scotians, by and large, have understood how they need to do all these things together to keep each other safe. That is why I keep mentioning that at every briefing, because we can't let up. We can't become complacent on that. The third piece is, as the Premier has talked about, an ongoing discussion about what is the appropriate balance between how do we who comes into the province and how we then provide safety around those individuals, knowing that we have to balance. We can't remain tightly locked down as we were through March and April and May. We have to have, and we have substantially loosened things up. But we have to continue to have the ongoing discussion based on the epidemiology, both locally, nationally, internationally, around what are the appropriate measures of controlling our border. It's those three pieces that I believe stand us in good stead moving forward.
Chris, do you have a follow-up? Next question will go to CTV's Natasha Pace.
If there's any thought, since other provinces are now using the contact tracing app, to Nova Scotia using something like that?
So we have that. We're certainly people on my colleagues in the department that are involved in there's a whole federal, provincial, territorial group that's looking at that. It is being adapted implemented in Ontario. We're looking to see what the Ontario experience has been. It depends. The utility of this depends on a few things. The number of people who use it first and foremost. What are the parameters that actually trigger a notification? Because we don't, and then what is the follow-up information that people get if the notification is triggered? One of the concerns Ontario has raised is the potential for a lot of people reaching out to public health if they're notified, if I guess the parameters are too loose and they may not really have had an exposure, but they get a notification in their app, and that then generates a lot of questions and then follow-up work by local public health. So we're aware of the potential for this, the utility of this app, but we're also aware of some of the downsides, and that's why we're being careful about allowing. Ontario was chosen to go first. We're looking to learn a bit more from Ontario before we fully jump on board with this.
Also, in relation to the nurse, the home care worker, can you just clarify, would public health be testing all of the clients that person was in contact with? And also, is there any connection at all to Northwood with this home care worker?
So second, no connection at all with Northwood. And as I said earlier, we're doing individual assessments for each of the clients. Whether they're tested or not will depend on the determination of what type of exposure they may have had, which really depends a lot on what kind of care they were receiving from this individual.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. Dr. Strang, in regards to limiting the COVID symptoms for testing, given what we know about asymptomatic cases and mildly symptomatic cases, why are we limiting testing symptoms right now, especially with the influx of new students?
So we're not limiting testing. We're saying that based on our experience for the last number of months, we had a limited or a narrower set of symptoms. We broadened that out in May, and we've had that broad symptoms. When we went back and looked at how people actually presented with COVID, based on our experience and talking to other jurisdictions, we're very comfortable that the symptom list we have now is how people are presenting. That the broader symptom, at the time we wanted to have a very low threshold for testing. We still want to have a low threshold for testing, but as we looked at it, it was unnecessarily broad. And so we had a lot of issues about kids in daycare through the summer with a runny nose, which at the time qualified for a test. And as we look at it, realize just a runny nose isn't how COVID presents. So we have, on a clinical basis, narrowed down the symptom list again, and I'm very comfortable that we still have an appropriately low threshold. That's why we say to people, if you're not feeling well, go home or stay home. Do the 811 assessment. Then 811 has the expertise to guide you through to whether you should be tested or not. But I'm very comfortable that we have an appropriate symptom list, which is our screening tool for COVID.
Lindsay, do you have a follow-up?
Yes. And then back to the home care worker who's recently been tested. I'm curious, when they were first tested for COVID back in the earlier days of the pandemic, and then were they tested negative at one point for their case to be considered resolved, or was it just that the time had sort of passed to allow that case to become resolved after the initial positive?
Yeah, when they were tested, by the time they were tested, it was early May. We were no longer using tests as proof of having a resolved symptoms, based on lots of national conversations. We were calling people resolved if they were at least 10 days from the onset of their symptoms and their acute symptoms had resolved. So this individual met those criteria for have their case resolved, went for 4 months, and then developed new symptoms which screened them in for COVID testing again.
So to clarify, is it just 2 tests? A positive in May and then a positive?
We've done some other tests as well. All the more recent tests have all been inconclusive, working with the lab for, so it's a complex, puzzling case, and that's why it has a lot of scientific implications, and that's why we're working very closely with our lab colleagues locally and nationally about how we further examine this. What are the potential further lab tests that we could get to try to prove, as has been done in other cases around the world that have then been published. You have to take a number of steps to be able to reach a firm conclusion that yes, indeed, this is a reinfection. I'm not a lab expert. I can't get into the details, but we're very careful. We're going down that road. But in the meantime, we're erring on the side of caution and saying we're going to assume this is a new case and take all the appropriate steps. We may end up at some point making a conclusion and say that was unnecessary, but I'd much rather do that than err on the side of not being cautious enough, and then all of a sudden have people with COVID that we somehow missed.
Next question will go to Tim Biscay with the Halifax Examiner.
We just got a email alert from the RCMP that 4 university students have been charged for violating the self-isolation order. I'm sure most are obeying the order and so forth, but I haven't seen any messaging around young people and hooking up, sexual culture, that sort of thing, and it's not violating the group of 10. I just, why hasn't there been more messaging on that front?
We just haven't gone to that level of specifics, right? I mean, I don't know if we need to. Dr. Teresa Tam has done that. Whether that's appropriate or not or necessary, I think ultimately, people are going to make their individual choices about their sexual activity. I think more broadly, what we need to do if 2 people are choosing to get together closely, well, those are their choices, and if they transmit COVID-19, we have 2 people involved. From a public health perspective, I'm much more concerned about large groups of people and how they socialize in large groups rather than what 2 individuals choose to do.
Tim, do you have a follow-up?
Yeah, you've been very clear throughout this pandemic about the focus on public health, and that's your job as Chief Medical Officer. And I see very often through this that you've made decisions that may not be politically popular, and that's appropriate. I wonder if there's an inherent tension between you and the Premier, where, of course, he also wants the best health for the province, but he has political pressures as well. Hey, my business is hurting. Let's get these tourists in here. And I wonder if that tension, if you've reflected upon that tension, especially in terms of reopening or opening up to the rest of Canada.
So I think about it from my own reflections on this tension, and there are public health tensions in this. We know that I have to think about things of what is the appropriate level of restrictions to prevent the spread of COVID, but also knowing that each of those restrictions, and we have growing evidence on this, those restrictions have their own set of health harms. And so I personally think a lot about what is the right balance. It can't be all about COVID, but even from a pure public health perspective, what is the right balance of ultimately our goal is to minimize overall harms. And I try to apply that lens in my own thinking. I then give advice to the Premier, and I have never felt tension with the Premier. The Premier has been very clear that he is in charge, he makes decisions, but he's also, every time I talk to him, it's about he's put the health of Nova Scotians first in his thinking and how he accepts my advice.
Next question will go to the Canadian Press, Keith Doucette.
Visit the home care nurse. You mentioned some case numbers for potential reinfections. I wonder if you could provide a little more clarity around that. The number 3, what does that represent? Is that Canada, world? And if this is a potential reinfection here, would it be a Canadian first?
Yeah, so I think there's been, I'd have to go back and do a literature search. I think there's been 2 or 3 in the published literature where there's enough proof of it to be called reinfection, and that number is likely going to grow over time. Whether we get there or not with our case, at this point in time, I am not aware of any other a case in Canada that's reached the point where a firm conclusion to call it a reinfection has happened. I just want to caution that we're a ways from that even with our case, right? There's a number of discussions happening with labs and whether we can even get the right test done to do that. But it's a road that we're exploring at this point.
Keith, do you have a follow-up?
Yeah. So, but let's continue down that road. And if it happens to be one, what are the implications overall for our approach to COVID? And I mean, how do we handle something like that if it is in fact possible that people can get it more than once?
So as a previous question today, what it does is increase the possibility, increase the likelihood that we do not get long-term immunity from being exposed to this virus, which means that even if somebody has been from a very practical perspective, the first thing it means is that people who were infected in wave one may be at risk of being infected in subsequent waves, and therefore they don't get a free pass in terms of following preventive measures. It also has some implications for as we go down the road of how long we have to live with COVID-19. What role does a vaccine play? And this is all in the space of there are many unanswered questions yet around immunity in relation to COVID-19, including how a vaccine works, how effective and long-lasting a vaccine may be. All of which leads us to the point of that we need to continue to respect COVID-19 and focus on the interventions we know that do work, which are the low-tech public health interventions that we talk about at every briefing.
And that's all the time that we have for questions today.
Thank you, Chrissy. Earlier today, I thanked everyone for working together to keep our case numbers low, and I sincerely meant it. We could not do this without all Nova Scotians rowing in the same direction, and with a clear focus of following the protocols, washing our hands, keeping our distances, and wearing our masks. But I am worried that some are becoming complacent, and as a result, taking unnecessary risks. Dr. Strang mentioned the lineup of young people waiting to get into a bar on the weekend. But I've also seen young people traveling in packs, and I've gotten complaints from Nova Scotians about the pack mentality in public places and on transit, not distancing, not wearing masks. This is what's going to get us in trouble. I am worried arrogance is seeping in. Just because we in the Atlantic bubble have a better record than the rest of the country doesn't mean that we are safe from COVID. Our cases are low because we have all worked to get here. We can't stop now, and we do not want to have to shut down businesses again after they are finally reopened. We need to live with COVID, but we also need to remember this virus is vicious. It has taken the lives of 65 Nova Scotians. Imagine how those families are feeling, and we cannot forget their pain, and we don't want this to happen to other families in the future. And if you think it can't happen again, just look at other provinces who thought they had flattened the curve, and now their numbers are spiking. We cannot take this virus for granted. It is here, and it loves, quite frankly, when we gather in groups and don't distance. It loves when we don't wash our hands, and it loves when we don't wear our masks. What it doesn't love is when we follow the protocols. Let's say, not here, not in our province. To the students who've come into Nova Scotia from outside of the Atlantic bubble, and to the visitors who come in from outside of the Atlantic bubble, please cooperate and isolate.